This vignette demonstrates how computerized check-ins and monitoring can support recovery for clients with co-occurring substance use disorders and SMI. The vignette includes examples of how checking in via a desktop computer, a tablet, or a mobile phone can benefit both clients and members in managing their recovery. How to build clients' engagement with the check-in process as part of their recovery plan, and how to teach the basics of computer use to clients who are not already computer literate. How computerized check-ins can more readily involve hard-to-engage clients in taking responsibility for their own recovery, and how to help clients use technology to maintain a connection to treatment resources after formal treatment has already been completed. These technologies can be useful in a variety of behavioral health settings to help clients maintain self-management, recognize potential relapse factors, and see long-term progress in recovery. The learning objectives for this vignette is to identify how a computerized check-in process can be used in behavioral health settings, introduce some skills for counselors in educating clients, particularly those who are not computer literate, to the use of computers for checking in and monitoring. Address any problems that can arise when clients don't check in or they're unable to complete the check-in process, to demonstrate how to use a computerized check-in process to monitor progress and changes over time for a client in recovery from CODs. The term co-occurring disorders, it indicates that a person has both a substance use disorder and a mental disorder that neither disorder is caused by the other. Both are independent disorders that warrant individual treatment. And also to engage clients in taking responsibility for their own recovery process. Some situations in which a check-in process can be particularly beneficial: transitions from a higher to a lower level of care, like from inpatient detox to an intensive outpatient program, from a residential treatment to a halfway house. Periods of obviously increased stress, so a loss of a house or domicile or an intimate relationship, the death of a loved one, with a risk of relapse to substance use or an exacerbation of the mental illness. Any adjustments or alterations of medication for mental or substance use disorders, an increase in the client's need for motivation and support to continue treatment, like feedback on the client's own responses, that can be very useful. Repeated admissions and difficulties in linking levels of care and recovery, and also in introductions of new treatment methods or approaches that aren't familiar to the client. Clients who express reservations about technology-based interventions, they may be reacting to a combination of discomfort when using a computer, the introduction of something new into their daily regimen, and a manifestation of symptoms that are related to substance use or mental illness. So in this vignette, part of what drives Sandro's reluctance in suspiciousness resulting from his paranoid illness. Staff members have already ensured that Sandro has basic literacy skills to handle questions on the computer screen, but it's worth noting that a lack of basic literacy skills can contribute to the client's resistance in situations like Sandro's. So how do we engage clients with the automated check-in system? Well, to appeal to clients, there has to be some noticeable benefit in the use of any type of automated clinical tool. So here's some strategies that can help increase the likelihood that our clients will use and benefit from an automated check-in system. We want to encourage the client to tailor the information exchanged to their own recovery goals. We want to give something back. The benefits of one-way reporting to a clinician on symptoms might not be obvious. Some helpful responses delivered either in person or via an automated messaging that should be tailored to the client's needs and desires. We want to allow the client to practice using the system with a staff member present to help assist with the process and answer any questions that come up. We want to be clear and direct about the risks and the benefits of participation and encourage the client to make their own choice about participating. We want to engage peers who have found the system useful to help that client acknowledge the benefits and to practice using the system. We want to overcome equipment related barriers by providing access to necessary devices like mobile phones, tablets, or computers. And lastly, we want to use motivational interviewing to assess the client's willingness, their plans to engage, and any perceived. So, some common points of resistance that clients have to computerized check ins include reluctance, which is shame or embarrassment about using a computer because they've had a lack of exposure to the technology or training in how to use it. They may have limited reading skills or illiteracy. They may be ambivalent about recovery, about having their craving, their substance use, and mental illness symptoms logged for clinicians to see and reflect back to them. They might be annoyed at being made to do something by somebody they perceive as more powerful than them. They might have a general concern or anxiety about doing something new or fear that the information provided is going to be used against them. To overcome the resistance to these computerized check-ins, you can use the same strategies that you might use to motivate clients to complete paper check-in forms or any other tasks. You want to help the client see the value of the check-in so that they'll want to do it on their own. You want to help the clients link their progress towards one of their goals with the use of the program. We want to use motivational interviewing skills when starting clients on a new task. We want to work with our clients to identify and overcome any perceived obstacles to using the program. We also want to emphasize the importance of collecting data for the client's own well-being and then help that client to feel like they're part of their own recovery team by completing that check-in. We want to create private spaces where clients can use the computers and they can't be seen by the rest of the client population. We want to provide the trained staff members or peers to help troubleshoot and make available written how-to sheets about operating the hardware or accessing support sites. We want to attend to any internet privacy and security standards by installing up-to-date virus, spyware, and malware protections. We want to protect the client privacy by setting the machines to automatically delete the cookies, the search history, and any other private information that could otherwise be stored on the computer. We want to provide easily accessible links to support and education sites that you know are reputable and block access to those non-treatment sites just to ensure that our clients spend the computer time on treatment-related activities rather than personal business like visiting social media sites. We want to offer basic computer classes that are taught by volunteers from the community and possibly consider firewall implications when using network computers for client access to protect against any unauthorized access to electronic clinical record systems or any other confidential business applications. So here's an example. In a psychiatric inpatient and day treatment program in Western Australia, touchscreen access has been provided to clients participating in CBT groups. Clients complete the World Health Organization's 5 Wellbeing Index, which is a 5-item measure of psychological well-being each day. The therapist provides the client with a printout graphing their progress compared with expected progress and then discusses the results with the clients in a weekly group. The therapist can use the well-being trend information to discuss treatment progress and realign treatment plans with their clients. An evaluation of the use of the touchscreen check-in demonstrated high levels of staff and client satisfaction with the tool, and client reports indicated the use of the technology increased their discussions with their therapist about the treatment progress, and it also enhanced their understanding of the progress. The privacy and confidentiality standards and regulations that typically apply to the behavioral health services, including Title 42, Part 2 of the Code of Federal Regulations, the confidentiality of alcohol and drug abuse patient records, and the Health Insurance Portability Accountability Act, or HIPAA, their privacy rule. These also apply to electronic exchanges. And as with any exchange of health records that are subject to 42 CFR Part 2, the clients have to provide written consent to share that information across providers. Many states have laws that require consent for sharing information that's related to mental health. So, offering clear, simple descriptions of the ways that confidential information is going to be exchanged and providing a rationale for the exchange, along with an explanation of any risks or benefits that are associated with that electronic information exchange, is going to help the client make a more informed choice about how their information is shared across providers and organizations. Providers have to ensure that the transmission of that protected health or other confidential information is completed securely. So, in general, studies of computer assisted self interview instruments demonstrate that clients are sometimes more forthcoming about sensitive or embarrassing or shameful information when they disclose it to a computer program uh, rather than when they're in an in person interview. Web-based daily completions of check-in forms build on these studies by providing clients the opportunity to check in without talking directly to a provider. A daily check-in process also provides a structure for collaboration between the client and the provider and a way for the client to be more actively engaged in their recovery. So, to support the client in repeatedly filling out check-in forms time and time again, the form has to be relatively brief in length. Take only a few minutes to fill out, and it needs to be meaningful to the client to sustain the motivation to complete it each day. The goal is to identify a few questions that are meaningful and important to both the client and the provider. There's some alternative approaches for conducting these check-ins. You can do it by voicemail or interactive voice response systems, mobile phone apps, secure web-enabled tablets or personal computers, by structured emails, or even pencil and paper checklists that are entered into a computer tracking system later. The ability to customize the check-in form creates the clinician buy-in by meeting the needs of their programs, and it also produces client buy-in as the clients can add items they identify as important metrics of their own recovery. Initially, it's going to be helpful to ensure that the support staff members also understand the program and that they can adequately answer any client questions, and they're supportive of their clients' use of the program. Double Trouble in Recovery is a 12-step program for people with co-occurring disorders, and it's based on the 12 steps and the 12 traditions of AA. Other programs, such as Dual Recovery Anonymous, these may be available in your area. Sometimes the term double trouble is used to indicate that someone has a substance use disorder and also has a addiction, or that someone participates in multiple 12-step programs. How do we talk to our clients about using technology in their care? Discussing the risks and the benefits of using technology differs little from other discussions about changes to the treatment plan. So let me give you a few tips here. Be honest. Don't oversell either the risks or the benefits associated with using technology. Discuss the ways that technology can be helpful and the risks that are associated with using technology as a tool. Honor and support our client preferences. Ultimately, each client has to decide whether to participate. It's a sign of recovery to make informed decisions about one's own life and treatment. We want to use change sampling. We want to allow the clients to agree to a short trial of at least one aspect of a given technology-based tool or intervention, and then this is followed by a discussion of the experience and a renegotiation of consent to participate. It's helpful to demonstrate the use of the technology and then have the client try it in your presence to ensure they're able to use it properly. You might want to enlist some peers. Other clients or past clients who have successfully used the technology can be effective champions and provide clear and honest feedback about the ways it helped or hindered their recovery experiences. We also want to give back. No one likes to spend time doing something that has no personal payoff. So help the clients identify the ways that the technology might help them. And if the benefit to the client is distant, find ways to enhance the incentives to participate. So, how do we design these supportive messages? We want to have this collection of brief messages that reinforce recovery and can provide a quick and efficient way to help sustain that client motivation. So, we want to ask the clients to help design and select the messages that are important to them. We want to tailor the messages slightly to the circumstances of the client. So, for example, if you know that a specific holiday is hard for a client, send a message on that day or a few days prior, just acknowledging the challenges and giving a tip for dealing with stress. We want to phrase the messages positively, emphasize what can be done rather than what should be avoided. And we want to use peer support staff or peer counselors to send these messages. These individuals can have a different type of credibility than the professional staff members. We also want to consider fine tuning the text messages for anniversaries, particularly those of stressful events, or to serve as reminders of specific appointments. Sending messages at a particular time of the day or week to correspond to client needs can really be helpful. If clients will regularly receive texts from you, you should be aware of their cellular plan costs for text messaging so that the costs don't become burdensome. Also, we need to keep in mind that text messages are rarely secure or encrypted. Anybody with access to the client's cell phone can easily access their text messages. So we have to keep this in mind that they can do that even after they've been erased. They may be accessible on the subscriber's identity module card in the phone. So if counselors use text messaging for reminders, support, or other purposes, you might want to keep the messages vague and not reveal any personal data. The client needs to provide specific informed consent related to the specific benefits and hazards of participating in online care. With that said, the use of encrypted and secure communications as part of electronic health record systems is really growing rapidly.